Welcome to the Maxicare Wellness Fridays with our topic, Happy Kidneys, the Golden Rule, and Warning Signs. My name is Patricia Bermudez. He's on your host for today, and I'm happy to be with you again in this webinar series because we are tackling a really relevant and important topic today. So do share your thoughts and learnings of this event through your social media accounts using the hashtags Live Your Best Life and hashtag Maxicare Wellness Fridays. And please don't forget to tag Maxicare using the social media handles that they have. For example, on FB, it's at Maxicare Healthcare Corp. Their official IG is at Maxicare Healthcare. And the Health and Wellness team also have their own IG, which you can check out and follow. That's Maxicare Health and Wellness. Have you subscribed to their YouTube channel yet? Well, you can look for them. And it is Maxicare Healthcare Corporation as their channel name. Now, for those of you who are watching on live stream, may I ask you for a quick favor? I know that many of you are watching us right now. Do press that share button. Now, yes, you can share this event right now and help educate your friends and your loved ones by posting this event on your pages. And of course, can I ask you to also hit that like button like many times now, but every time you hear something relevant to you, do hit that like button because it helps us understand what you guys are looking for. But today, we do have wonderful experts like Dr. Ito na naman tayo, Erosthenes Polito. I'm gonna call him Doc Soy because they were close like that. But Dr. Erosthenes Polito and the beautiful Bea Rose Santiago, who will share their expertise and experience about kidney health and diseases. In this interactive session, we will learn how to protect our kidneys, which is a very important topic because one of the leading causes of death in the Philippines is kidney disease. I know you guys are really excited for this conversation and are looking forward to learning, but first, can we learn from you? Because we have a couple of poll questions where we'd like for you to engage with us and answer. This is going to be real quick. All you have to do is click on the answer that best suits you. Ready? Here we go. Here's my first poll question. It's confession time, actually. What among these common food habits do you have? Confession time. So you have to be honest. Do you love perfectly or sometimes overly seasoned salty dishes? Or what about you? Are you a busy person so you resort to preparing easy to cook processed food or canned goods? Or do you love meat and sometimes forget to eat a balanced diet? Meat is life. What about this? I eat foods high in sugar almost every day. Kind of think about whether you do that. Or do you drink heavily on a regular basis? Can I know the results? I'm sure we will all learn from each other no matter what habits we have, but I see that majority of us, we love meat and we sometimes forget to eat a balanced diet. And because this is confession time, a lot of people also confess to having perfectly or sometimes overly seasoned salty dishes. Noted on that, you will definitely learn and maybe be inspired to make some changes. But here is our second poll question. What specific topics are you most interested in this session? We know that you're here because of the general topic, but is it also because you want to learn more about the main causes of kidney disease or the warning signs or how to avoid kidney disease? Or what about the complications that come along with it? What about foods that can repair the kidney or how to achieve great kidney health so we can have all happy kidneys, right? So for me, I probably want to achieve optimum health. And that looks like majority of the people also want to know more about how to achieve great kidney health. But most of us, and the number one out of the list came out to be the warning signs of kidney disease. And I'm glad that you're here. And also the foods that repair kidney. And I'm glad that you're here because these topics are really what we're going to be zeroing in on for today. Here's our third poll question. Select the age range that applies to you. Are you between 18 to 30 years old? Or are you 31 to 40 years old? Or are you 40 and above? Right here, 40 years old and above. We just want to know the kind of audience that we've drawn today. We have a great turnout today. And most of us are 40 years old and above. Many are 30 to 40. And I'm glad that there's also a lot of you who are younger than that age bracket because there is going to be some parts of this conversation that definitely will help, especially the younger ones, understand what they ought to do. Well, what about this? When was the last time you had your checkup for your kidneys? Do you know if you had it a few weeks ago or months ago, so it's quite recent. What about last year, or you just can't remember, right? Sometimes we don't know if we did, or we think we've never ever been deliberate or had our kidneys checked. Before I reveal what types of checks, because we will leave that to the doctor, I can see that a lot of people think that they have never, or have shared with us that they have never had a checkup for their kidneys, or some people have had it recently. So we have both ends of the spectrum here. Well, you came to the right place, and you will have your questions regarding that answered. But thanks so much for participating in our poll. Now it's time to meet your speakers. Our first speaker is a doctor of internal medicine, adult nephrology, and hypertension, and he's also a diplomat of the Philippine Society of Nephrology, a diplomat and fellow of the Philippine College of Physicians, and a member of the Philippine Medical Association. We're very happy to have Doc Soy Polito. Now, joining Dr. Polito is another speaker who is an international model, Binibining Pilipinas International and Miss International 2013. She is a kidney disease fighter and advocate. Here is Bea Rose Santiago. Let's have both of our speakers up on screen. We're so happy to have Bea. Hey, Bea. And Doc Soy.
Hi.
Hello. Bea, we are calling you not from a
Mhm.
particular point in Manila. You're out of the country. Can you share with us where you are exactly?
So I'm actually in Vaughan, Canada. So I'm an hour away from downtown Toronto. So hi guys, it's AM here, 5 a.m. to be exact, actually.
Good morning to you, Bea. We're so happy that we have you. And of course, Doc Soy. Doc Soy, have you been busy? Have there been more and more patients that have now been seeing you?
Yeah, currently we are seeing more patients, especially that we already have the vaccines. So it's a good thing that patients are coming out to the hospitals and to the clinics to have themselves checked.
Oh, good. Now, before we actually get into our conversation with Doc Soy and Bea, I'd like to share with our audience here some trivia that will help us understand about our topic. So, before we begin, let's have trivia time. I love going through these trivia because it allows us to better understand what we're going to be zeroing on, and of course, the topic in itself. And I'm sure Bea, Doc Soy, I will be able to refer back to these trivia during our conversation. But here's the first one. According to the National Kidney Transplant Institute, one Filipino develops chronic renal failure every hour, or about 120 Filipinos per million population per year. So we sourced that from NKTI. Here's another trivia. The average cost of a hemodialysis session in the Philippines is about 4,500 pesos. Now, given that the recommendation frequency, or the recommended frequency of sessions per week is 3 times, then imagine that the total amount of expenses for a dialysis patient is 13,500 per week. That's a large expense for an average Filipino, and that was sourced from the PNA. Now, here, the 10th leading cause of mortality in the Philippines in 2020, kidney failure, is one of the leading causes of hospitalization. Now, for the past decade, the prevalence of dialysis has increased to approximately 400%. It is now projected to be the fifth leading cause of death by 2040. And Doc Soy, I'm going to be going back to that to you in just a short while, but let me read our fourth trivia. Kidney patients are more vulnerable to COVID 19. Patients with chronic kidney disease, patients who have had kidney transplants, patients who are on hemodialysis, and patients who have developed acute kidney injury. And finally, here's our last trivia. According to an article in 2018 by Business Mirror, a kidney transplant costs half a million pesos to 1 million for a one-time surgery, as long as the donated organ is not rejected by the recipient's system. Doc Soy, we're here to talk about the golden rules and warning signs of our kidneys, happy kidneys. But I wanted to ask you about that first and third trivia, particularly how they're are more and more Filipinos who develop chronic renal failure and kidney disease. And now it's going to be from 10th to the fifth leading cause of death by 2040 for Filipinos.
Okay, the reason, looking at the numbers, you see that the numbers of patients on hemodialysis is increasing. So it looks alarming, but looking at the brighter side, then we can surely say that little by little, the Filipino people are accepting that renal replacement therapy really helps.
Mm.
So that's the thing about the increase of 400% of
Mhm.
hemodialysis among Filipino people, because Filipino people are now somehow educated and they
Yes.
already know that renal replacement therapy such as hemodialysis, peritoneal dialysis, and kidney transplant really do help.
I love that you talked about education, and I think that's why we're doing this here at Maxicare. But we'd love to hear it from you, Doc Soy. Why is it important for people to be aware, to know the golden rules and warning signs when it comes to kidney disease?
Yeah, because little do we know that we have to take care of our kidneys the same way that we have to take care of our heart. A lot of people are taking care of their heart. They are very watchful
Mm.
about their BP. They are taking care of their lungs. That's why they have to cover their noses whenever they go out. And but little do we see people saying that they are taking care of their kidneys. But if you are taking care of your kidneys, you are also taking care of your heart, your lungs, your brain, and other systems or other organs as well.
You know, we have an advocate here and a fighter. That's why we have Bea here. Bea, you obviously, we have some people here who are saying, "Oh my gosh, Bea Santiago is here," and that was my reaction also. Oh my, Bea Santiago, what a beautiful person that you are. But you are a kidney disease warrior, fighting daily and winning. Um, why did you want to be vocal about your journey?
You know, before I got sick, actually, I kind of asked God. I had a prayer, and I asked for some a new chapter, a window, a new door, and I think to be exact, 2 months to 3 months later after that prayer, I was diagnosed. I had a biopsy, and I found out that my kidneys were 15% working, and at first, I was confused. I was in denial. I was sad. I was frustrated. I was doing self pity, and then I realized, I think I was given this purpose because I have to share to the world, and show awareness that anybody, young, old, beauty queen or not, you can get sick. And that's why I think it's an obligation of mine to share it to the world because since nobody's talking about it, might as well share and maybe save a life.
No, you're right. I mean, I could be remiss, but I don't think there are a lot of people, personalities like yourself, who are coming forward to talk about this, which is why we have this wonderful golden opportunity to have this conversation here on our Maxicare Wellness Fridays. So, Doc, why don't you first educate us on what kidney disease is?
Okay, I think for us to understand what kidney disease is, firstly, we have to appreciate the functions of our kidneys. So, one of the functions of our kidneys is it help in cleaning your blood. Second, it filter extra water out of your body. It help in the production of red blood cells. It helps in the metabolism of calcium, vitamin D that is needed for the bone health. And lastly, it regulates
Mhm.
blood pressure. So when you say kidney disease, these functions that we have mentioned earlier will be lost. That's why an individual or a patient will manifest with brittle bones, elevated BP or uncontrolled BP. They will have anemia, and waste products and fluid can build up in their body. And when you say kidney disease, it is staged accordingly. So for us to know the severity of a kidney disease, it is staged into one, two, three, four, five. And if the function of the kidneys is less than 15%, then that is already end stage renal disease. So in the early stages of kidney disease, you will not feel anything. You will have no symptoms. It is only when that the stage of your kidney disease is very advanced, that's the time that you will have symptoms. That's why kidney disease is considered to be a silent killer.
I'm absolutely scared of that term, silent killer. But I guess that's something that we really should be talking about, which is why we're here. But okay, so what are the signs and symptoms? Since it's a silent killer, what are the signs and symptoms that would prompt us to seek consultation?
Yeah, I think it is very important that when you notice that you already have swelling in your feet or in your ankles, especially it is coupled with elevated BP, then that should prompt one to seek consult. If you don't see these swelling or edema and elevated BP, other symptoms such as nausea and vomiting, loss of appetite or metallic taste in your mouth, you have fatigue, weakness, or sleep issues like insomnia. These manifestations are collectively called as uremia, wherein the toxins in your body is accumulating. So that should prompt one to seek consult. Another important symptom that should make one see a doctor is chest pain. If you already have chest pain, then that could mean that fluids is already accumulating in your heart. Or it could be shortness of breath, dyspnea, or difficulty on breathing, wherein the fluid builds up in your lungs. Then that should prompt one to seek consult.
Thanks so much, Doc Soy, for all of those. But okay, so now that we know what should prompt us to seek consult, how do we know if our kidneys are actually healthy? What are the tests that we should be taking? And do we need to do this annually? Earlier, we asked our audience if they actually have had their kidneys checked. Not a lot of people know what specific tests there are to get to do this. So kindly educate us on that, on how we can know if our kidneys are indeed healthy.
Firstly, you have to see a doctor, any doctor, general practice doctor, internist, not necessarily a kidney doctor. So, firstly, the doctor will ask about questions regarding family medical history of hypertension, diabetes, kidney disease, obesity, and the likes. And then the doctor will ask if you are taking medications, what these medications are for, and the doctor will order some labs such as simple complete blood count. We mentioned earlier that one of the functions of our kidneys is to produce red blood cells. If you see anemia in your complete blood count, then likely your kidneys are already failing. Other labs, simple labs, include creatinine and BUN because these are surrogates of toxins are already accumulating in your body. And lastly, the urinalysis. Regarding annual physical exam, it was mentioned earlier regarding annual physical exam. I think CBC, creatinine, BUN, and urinalysis are already included in the uh, annual exam. And before you know it, your doctor is already screening about kidney problems.
So there you go. That clarifies it because I think a lot of people really do those tests, and it seems simple and routinary. And they do get those tests. They just don't know sometimes what can be found in those tests. So thanks for clarifying that, Doc. Now let's go to Bea. Bea, let's talk about your journey with
Mhm.
kidney disease. How old were you when you were first diagnosed, and do you remember what triggered it?
Okay, I was 16 when I got sick. We actually went to the doctor because we thought I have some allergies. My sore throat was really bad for almost a week now, and I was feeling like fluish, almost like runny nose, symptoms of like a severe allergy reaction. But then we saw a few rashes on my legs, which was kind of in the middle of the skin. It's not bumpy, it was just like red, like dots in my legs, which was weird. So we went to the emergency and it was weird because they made me have a urine test almost 3 times. And they kept asking me if I have my period. I said, no, I don't. And so when they finally called us in, they were puzzled for a young age that my creatinine was really high and I have a lot of protein in my urine, which was alarming. And so we did 1 year of testing. And so we found out that I have IgA nephropathy, stage 1, at age 17. And from then, we did a lot of weekly tests until I was told that my body kind of healed myself. But I was not educated that once you are diagnosed with IgA nephropathy, you are living with an autoimmune for the rest of your life.
You were quite young.
I
You
was
said
very
that you were
young.
16, 17 when that
Yes.
happened. And apart
Mm-hmm.
from those tests, um, were there annual tests that you needed to do, even though you felt that, you weren't educated maybe on some lifestyle changes, but what were the other tests that you needed to have done and of course, the steps that you were supposed to take to address it?
Mm-hmm. Yes, yearly or twice a year, you're supposed to have your annual exams. But during that time, I was in the middle of finding career path for me. So I moved to the Philippines. I lived there for a couple of years, and because I was in such a very fast-paced kind of lifestyle, I put that on the side to go into the hospital because I thought I was very young and nothing's gonna happen to me. I was a very stubborn 20s person. So don't do what I did. And yes, that's what happened actually. And at a young age, I had biopsy. At age 16, I had a biopsy, and that's how we found out I had IgA. I have IgA. And another trivia is that even though I am transplanted, I still have an autoimmune disease, so it could come back even with a new transplanted kidney.
Well, thanks for sharing, Bea, and thanks so much for your honesty. I mean,
Thank
a
you.
lot of us, given the opportunities that were before you, a lot of us would probably also have put, certain things, the back seat, right, and
Mhm.
not be as focused on that. But Doc Soy, with Bea's sharing, is it normal for someone that young to have kidney issues?
Oh, yes. A kidney disease can affect all ages, and for example, IgA nephropathy for Miss Bea, even it is the most common glomerular disease worldwide, even in Asia and Pacific Rim, it can affect all ages and sexes. If you have read that IgA nephropathy is more common in the 30s, but it can also occur during the teens. And other sources will say that it is more common in men, but it can also affect women. So it affects all ages and all sexes. So,
Pero grabe yun, ano? So you're saying
mm,
it's more common for older men, and here you have a young female, a female teenager who was going over this. I mean, one lesson that I picked up there, I mean, as a parent, now even teens, we have to be deliberate, really, in making sure that our kids also get checked and have their annual physical exam. Because, Doc, tama ba, not everyone gets diagnosed early.
yes, not all, especially that we mentioned earlier that it is a silent killer. And during the early stages of kidney disease, you will not feel anything. You don't have any signs and symptoms. So it is only when the kidney disease is very advanced that you have those symptoms of edema,
Yeah.
elevated BP, and uremic symptoms such as nausea, vomiting, and the likes.
So, Doc, what's your advice, Kaga, to someone who sees early signs of kidney disease?
You really have to go to your doctor, and you just have to be honest that you have these symptoms like you have a frothy urine or you have a very bubbly urine every time you urinate, and yeah, all of those things. You just have
Uh,
to mention it to your doctor.
yeah, pero si Bea, yung mga triggers and early signs niya, no? Is that something that we all have to watch out for as well? The rashes, flu-like symptoms, and all of that?
Yeah. Um, the problem with kidney disease is that you don't have any specific symptoms. Just because you have a back pain, then
Mm-hmm.
that's kidney problem. But for Miss Bea, you have rashes, you have runny nose. That's very typical of IgA nephropathy. When you have upper respiratory tract infection and then a day after you will have changes in your urine, like discoloration in your urine. That's more likely IgA nephropathy. So just because that you have runny nose, then you don't have any problems in your kidneys. That's why it's very important that you have to see your doctor.
I love the learning here. We're talking about really wonderful nuggets of wisdom here from Doc Soy and Bea. So thanks so much for sharing. Bea, you've now been
Mhm.
living with this for over 11 years.
Yes.
Um,
Mhm.
and you mentioned, right, it was during that time as you were living with this, especially in the early stages, that you became an international model, a beauty queen, a host, an actress, and have achieved so many great things in your career. You had so much going on, and you still do, right? But looking back at what you've accomplished, honestly, it didn't seem like you had this disease. It didn't seem like you were being affected by this disease. You really, you I didn't mean, it's not like you're on a show, but it's just so alarming to me that you really cannot detect it if you're not intentional about it, Bea.
Mhm. Yes, that's actually true. That's why it's very important that even if you don't have an autoimmune like I did at the young age, you really have to go to the hospital or get checked yearly. And as for me, somebody who's went through it at a young age and at a very early stage, I should have went to the hospital at least twice a year just to get my creatinine checked, which I did not. And but I tried to live a healthy life. I was very strict on my diet. Although I think one of the most significant part of my kidney problem was that my stress was very high, and in my my lifestyle was very fast paced. I should have like calm down, relaxed, and and sit down. But at that 20s, for any person, that is the most, I guess, that's when you really have the drive to see in your career and your path in life. And so I was really, really just doing what was given to me, and I was trying to excel in every way. And but I did not. I forgot to take care of my health, which is most important because money can't buy health.
Oh, Bea, I just really admire you for your sharing and those great reminders. I think these are wonderful and important life lessons here
Yes.
that we're learning from Bea Santiago. I mean, stress is a huge factor that can greatly affect our health. Bea thought that she was young and can naturally overcome health issues. And like you said, you thought you were just doing the right things, focusing on your career. You also, more than that, you would think, oh, she wasn't taking care of her health. But what we saw was that you were actually quite active and healthy. You were working out constantly.
Mhm. Yes, and I was very strict on my diet as well because I have to remain in that beautiful body. And so I was very active, working out. I have a very active um, life. I have a lot of friends. I go on hikes. I love outdoors. I even went to Apuwang Ud in Sagada.
Wow.
Yeah, so I try to live that way, and I like to be very active. I surf. I'm very outdoorsy, and I have 5 dogs that keeps me busy. And so it was just unfortunate that it was too late when I found out my kidney was already failing. I was an end stage renal failure, if that's what you call it. And so I felt like my story is something that should be open to a lot because I want mine to be some sort of an inspiration or some sort of an alarm for a lot of people, especially parents and individuals working in a very stressful life. So I hope that I serve as an example that you can never be wrong with health. You really have to take care of yourself.
You're really being strong, being a warrior, and speaking out about this. Yeah, you're educating and you're
Thank you.
inspiring many. I'll go now to Doc Soy. Doc, a lot of people wouldn't feel the urgency, just like Bea, especially when she was much younger.
Yes.
Is this the case also for many of your patients? Is this something that you see happening also?
Yeah, it happens all the time because I receive, or most of nephrologists will receive uh, patients with kidney problem who are already on their advanced stages.
Mm.
Because we have to look our kidneys in this way. Our kidneys are very adaptable, and they can compensate for whatever problems there is in our body, even if we already have kidney problem. So even if you have kidney problems and you are taking extra salt or extra starch or
Mhm.
having carbonated drinks, your kidneys will still compensate by excreting all of these elements from your body. So symptoms reveal themselves slowly. And the moment these symptoms come, you somehow are used to it until they are no longer bearable. So I think that's one of the reasons why some don't find the urgency to address the disease.
So you weren't alone, Bea, on that one.
Mm.
There are many, which is why we're having this great conversation on how to keep our kidneys happy. And I just have to say that Maxicare really picked a great topic for this, because I think we're really going to change the lives of so many people who are here to listen and hearing about this. And Doc, what I'm picking up from what you've shared and what Bea shared, that's why it's really important to get our regular checkups for this and in general, right?
Yeah. You really need to have a general checkup at least yearly. And if you already have a kidney problem, then you need to see consult or have to be seen by your doctor regularly, like twice a year. So I think that's the minimum.
Doc, what are the things that we can do in the early stages of kidney disease?
Okay, in the early stages of the kidney disease, the best thing that you can do is to limit salt. Yeah, no added salt in the diet, and then you have to stay away from over-the-counter medicines, painkillers, because these medicines may help you acutely, but if you are taking these medications for some time, then they can affect your kidneys.
Mhm. Thank you so much. I think we're going to be going over a lot of those lifestyle and food changes that we will be discussing also with Bea. And I think people should be taking down notes for that one. But I want to go to that, Doc, before we go back to Bea. Why do you need to cut off certain foods? Um, and and I heard this, like even some fruits and vegetables, not just the salty stuff.
Yeah,
Why is that? People normally think, hindi, okay yan, kasi it's a fruit, it's a vegetable, it's good for you.
yeah. Fruits and vegetables are very healthy for your kidneys until you reach advanced kidney disease. When you already
Mm,
have stage 4, 5, or ESRD, then you have to cut off fruits and vegetables because these food are very high in potassium. And during stages of kidney disease that is very advanced, you have a decrease in the excretion of potassium in your body. So potassium will accumulate in your body, and that is very toxic to your heart. That's why we ask our
Um,
patient to cut off fresh fruits and vegetables when they reach 4, 5, and ESRD.
I want to go back to what Bea shared earlier that, yes, she led a really stressful life, especially at that time, at the peak of her career. And she had to wear so many hats, Bea. I can imagine how busy your schedule was and how stressful that was for you. But, Doc, really, what role does stress play in all this? We all know the answer, but maybe we should hear from you.
It's a good thing that Miss Bea mentioned about stress triggers for the disease because we have to remember that triggers, stress factors can come in different sizes and forms. For example, our kidneys. Medications can be a trigger for a kidney disease. If these medications are not needed in your body and you are taking them, then that can be a stressor or a stress factor for your kidneys. If you say that these medicines are needed, but if they are not well adjusted, then that can be a trigger also for the disease. Another example is in our work, in our workplace, we can be so stressed. That's why we have to eat comfort foods. And comfort food come in extra starch, extra salt, extra sugar. And these extra something are very toxic to our kidneys, and they are stressors to our kidneys. And another best example for stressors is, even if you say that we are regularly exercising, which that is very good, but if you are taking supplements to enhance the endurance of exercise or to build muscle mass, then that is very toxic to your kidneys, especially
Oh.
if you have a kidney problem.
Bea, did you do that? Did you take supplements? Because I see you agreeing with Doc. Because you were
Yeah.
healthy, I mean, you were very active. Parati ka
Mhm.
nag-workout and everything. And sabi mo nga, kailangan mong ma-maintain yung natural naman na figure mo, I'm sure.
Yeah.
But did you have to resort to that? Kasi parang intense yung gym life mo eh.
Yeah. Actually, yes, at the end of before I was diagnosed. So like that year, I was very focused on becoming an Amazona. I want to be a very fit, very like more very strong because I've always been slender. I've always been the skinny, model type. So I wanted to become stronger, to have muscles, and so although I did not have any protein shakes, I did resort to taking half of the bottle of a one scoop of creatine, those like very intense pre-workout drinks. And so I did that, and also I would drink a lot of coffees at I think I started drinking coffee, a lot of coffee at the young age. And those factors actually did not help my kidney, most especially that I already have an autoimmune at a very young age. So I should have done like less of that and not a lot of heavy workouts, because those also have strained my kidneys. And I think that also is one of the results of why I got sick, aside from all the other circumstances when I was sent to the hospital. So all of those small little details that
Yeah.
for a normal, healthy people like person is, nothing to be scared of, but for people or individual who has already diseases like me, that's a lot of damage to the organs.
Now let's fast forward, Bea, when after you've lived your normal, successful life and lived with the disease for many, many years. But let's let's go back to just a couple of years ago. Something
Mhm.
drastic happened, right? Tell us about finding out how you were already in the advanced stages of your chronic kidney disease.
Yeah, I was in denial, most especially that I was very young. I was 28 and I was very active during that time. So I felt like they were wrong and that I know my body. And so I asked for I guess like a second doctor to confirm or to just deny it. And so I flew to to Japan for a second opinion. And I only got a confirmation. And they told me to fly to where I have suitable donors, which are my siblings. So I kind of was forced to go to Canada, where my family was. And so I was sent to the ER there because I almost fainted as well in the public area. And so um, it was very scary. It's really hard when your body is have its own mind and you cannot control it anymore. And so I was rushed to the ER and I was told that I need to either do a transplant or a dialysis. And so we did a dialysis, and I opt for a home hemodialysis type of treatment, which is I can dialyze at home in my own room, and I'll be my own nurse or also my own computer person to do the dialysis. So it was a flip of the coin. So from doing acting and doing hosting, I
Yeah.
have to go back to Canada where I lived before with my family, and I have to leave behind my whole career in the Philippines and focus on my health. And so that one whole year in 2018 was dedicated to my health. And so, yeah, and it was a total big change in my life, and it was I was very miserable. I was very sad, and it was a very sad moment in my life, but I think it only made my journey more powerful and more impactful in and not just to me but to my whole family and friends.
Yeah. And we will get to that on what has been the key for you. But I just wanted to point out again, sa mga nakamiss, her kidneys were only 15% functioning at that time. At
Hmm.
kailangan niyang bumalik sa Canada just so she can be close to her family who were to be her organ donors. And that was really a huge change. It's a huge change for her. So you were talking about the dialysis. You needed to go home to Canada. Doc Soy, I want to ask you about treatments or recommendations apart from dialysis. Pag ganun na yung sitwasyon.
If the kidney function drops to less than 15% and you already have those symptoms like fainting, difficulty in initiating sleep, you have lack of appetite to eat, then that's an indication for you to have renal replacement therapy. So when we say renal replacement therapy, from the words itself, renal replacement therapy, it will replace the functions of your kidneys. So one is hemodialysis, wherein an individual is attached to a machine, and then the machine will clean the blood and remove excess fluid from your body. The second option is peritoneal dialysis, wherein a doctor will place a tube in your abdomen and infuse fluids, and those fluids will stay there for some time, and that fluid will remove toxins and excess fluid in your body. And the third renal replacement therapy that is available is kidney transplant, wherein you need a donor and it will be transplanted in your body for you to have like a new kidney.
And we talked about earlier, it's a trivia time natin, we talked about the cost of all that it really is difficult for anyone, not just the average Filipino. Those are some serious numbers. Those are some serious, I guess, a heavy financial weight on anybody. And thanks for sharing with us the different possibilities, because a transplant is not always possible, and it's not just because of financial issues, kasi minsan hindi ka talaga makahanap ng donor na suitable
Yes.
for you. Bea, just two
Hmm.
months ago, earlier this year, you got your kidney transplant, right? With
Yes.
your brother as your doctor. Tell us about that, and tell us about how you and your system have adjusted.
Yeah, so my brother was is my donor 2 months ago. I'm in recovery still. I have to mark my first 3 months and then mark my first 6 months and then 1 year, and then that's when I can finally say that I've had a very successful transplant surgery. So it's been doing great, amazing. Like the first day I actually woke up with a new kidney, the few hours that right after I woke up, I felt, I forgot how it feels like to be healthy. So that was my first, when I woke up, I was like, oh my God, so this is how it feels like. I forgot. It was, I don't know how to explain it, but it was, I think most of people who went through the transplant can definitely say yes, right after, even an hour after, right when my kidney was functioning and was peeing normally. I felt healthy. I felt light. I felt, it was just a huge, beautiful way to wake up, and miracle actually. And then I owed that all to my brother, who was selfless and loving to me, and amazing, and that made it more special. And I have to take care of my body now, and I have to prioritize my health more than anything.
Yeah, I mean, such a huge change, right, in approach and attitude, and the way you now will be cherishing your health even more. But thanks so much, I think we'd love to know how your diet is now and what you
Mhm.
do to maintain this.
Yes, thank you for asking. That's very important in any diseases, actually. Right before I was diagnosed, when we were just checking out what's wrong with me and my creatinine was super high, I had to go on vegan diet. This is my pre-dialysis. So I was vegan
Okay.
for my pre-dialysis. And when I started doing dialysis, I have to be eating meat. So I have to eat protein, a lot of it, because I lose blood while I dialyze. And now that I'm transplanted, I have to minimize my salt, my sugar, because we're prone to diabetes as well because of the medication that we're taking after transplant. So, so I have to cut those, and also I have to eat a lot of greens, very much. So I go on a lot. I think I'm more on Mediterranean diet, so I have a lot of fish, a lot of leafy vegetables, and of course my rice is still there. But I have to walk at least 30 minutes a day, even though I am in healing, because I have to make my body stronger and my heart stronger as well. And I'm just super grateful that I can do those things, that I don't have to be attached to a machine anymore. And it's a beautiful, beautiful time for my life. And I'm just excited.
I like that. You constantly have gone through many changes dahil nga sa journey na pinagdaanan mo, no, with your kidneys from the time that you
Mhm.
were young, and now to really having to deal with this and completely change your life, lessen your stress. Is that obvious? That's
Yes.
obviously a priority for you. Less stress.
Yes. You know, during my second year of dialysis, that's when everything went down. And mental health is a huge, huge problem as well for all those struggling with any kind of sickness, any kind of disease, most especially those going through dialysis. And for that life that I had, very drastic change. I had difficult time adjusting. And so I was just very fortunate that I have an amazing therapist, Sapna, that you guys also have here in Maxicare. I was just very fortunate that our stars aligned. We met through she was going on a podcast, and I was just watching her live, and I found out that she is a therapist, and so she became my therapist for almost a year and a half now, almost going on 2 years, and I'm just so fortunate that she helped me a lot. My stress is now being handled. I'm an ongoing process, and I'm just so thankful that I have her to call anytime, whenever I am
Oh,
on, because it's very important, especially now that I am on transplant, and I have to live on medication for the rest of my life, and that medication comes with a little baggage, but nothing compared to having a new kidney. So I'm just very fortunate that I prioritize my mental health as well. So to anyone out there, please prioritize your mental health as well.
thanks. That's medication and meditation. And thanks
Yes.
for pointing out that it's really important to also take care of your mental and emotional health,
Mhm.
and to seek help. And you're one of those who, you know, are open about that, and we're glad. That's also one of the advocacies of this great organization. It's really good that you're able to do that. But what about drinking a lot of water? I've heard that. Is that important? It's important anyway in life, but for you,
Yeah, for me, I think Dr. Polito would probably say yes. Now that I am on, thank God, because on dialysis, we were restricted to drink at least 1 liter. But because I was on home chemo, I can dialyze 5 times to even every day. I did not have any water restriction or food dietary restrictions. But now that I am on transplant, my lifestyle have changed. I drink at least 2 liters to 3 liters a day because I drink a lot of I have a lot of medications and very heavy um, medications actually. So I want to flush that out in my system. So I drink a lot of water, and please drink a lot of water as well. Even if you're not transplanted, most especially those who are healthy, please drink a lot of water. 2 liters really was I mean the little privilege of having to go to the bathroom, that's a lot. That's beauty for us, people who went through dialysis. That's beauty for us. So I hope that everybody finds it a privilege to drink a lot of water and go to the washroom, because not everyone have the same privilege. So please take care of your water intake, your healthy diet, your stress, and go to the doctor every year. Right, doctor?
Yeah.
Yes.
Right?
Yeah. The good thing about kidney transplant is that we have to remember that we can live with one kidney. We all can live with one kidney. For a transplanted patient, it is as if that they are living with one kidney.
Mhm.
So yeah,
Doc, okay, Doc, can you tell us a little bit more, Doc, about yung mga lifestyle changes that they need to do to have to adopt to manage this disease?
yeah. Prior to hemodialysis or initiation of renal replacement therapy, there are a lot of things that should be adjusted, like protein intake. Proteins are toxic to your kidneys, especially if you are already on the advanced stage of kidney disease. Normally, these proteins will not be seen in your urine, but if you see protein in the urine, then that's a surrogate marker that somehow the architecture in your kidneys are damaged. And another point here is if this protein is present in our urine or in our kidneys for some time, then that will hasten the progression of kidney disease. So that's the reason behind that we advise our patient who are on advanced kidney disease to cut off their proteins. Uh, sh- salt intake is also one of the things that we should cut off in the advanced chronic kidney disease because salt can increase your BP and it can attract water. So you will have even more swelling in your legs and even in your lungs and heart.
Okay, Doc, can you just explain to us the rationale behind some of these lifestyle changes that have been shared here? You mentioned earlier, I love the example that you shared earlier about cutting off certain fruits when you get to a certain level in your kidney disease journey. But yeah, I think we have to just clarify some and maybe encourage pa yung mga ibang mga lifestyle changes at i-share kung ano pa yung mga rationale behind them.
Yeah. Another lifestyle change is that you have to frequently monitor your BP. Yes, because if you have a BP of more than 140 for so long, then that is very toxic to your kidney. That will hasten the progression of your kidney disease. Another thing also is that it should be part of your lifestyle modification that you have to monitor your sugar because the leading cause of kidney failure is diabetes that is not controlled. And carbonated drinks, you should cut off carbonated drinks or else you will develop stones. Another thing is, I think, um, I think those are the things that you really have to watch out for. And yeah, one important thing is over the counter medicines and herbal supplements. Over the counter medicines such as NSAIDs or non steroidal anti inflammatory disease, such as ibuprofen, phenamic acid, naproxen sodium, they can manage pains, but if you are taking these medications for quite some time, then that is very toxic to your kidney. So that should also be cut off uh, in your, in your daily life.
Yeah.
And herbal supplements also.
Down to our final thoughts. I'll start with Bea on this one. With what you went through with this disease at such a young age, how were you able to handle those hurdles? And paano mo mai-encourage at ano din yung mensahe mo to other people and their families who are also facing the same situation?
Yes. I wouldn't have not made it if it wasn't for my family, most especially my mom. And I'm just very lucky that my mom is, also in the medical field. My mom's a pharmacist, so she actually helped me years ago to help my doctors to find out that I have IgA. It was my mom who did the research so the doctors and her actually collaborated and found out that I have IgA nephropathy. And I'm just very lucky na my family is very supportive. And for everybody going through not just dialysis, not just transplant, all the kind of struggles in life, it's it's a very important to have a core group of family or friends, and who understands, who have a lot of patience, who are loving, who will just be your support system. Because when I was going through it, nahirapan ako ng sobra, not just physically but mentally. And I think very lucky lang na my family are very strong, and they told me, because I was the strongest in the family, and that I when I was weakened, they had a hard time also. So they were my support system all throughout the 3 years that I was struggling. And I'm just very fortunate na sobrang lakas din ng family ko for me. And to everybody going through it, please, please have a support system. Believe them, love them, and be there for them no matter what, kahit nasasaktan na rin kayo. Kasi nahihirapan din po kami, hindi namin alam how to express ourselves kasi ang daming nangyayari dito, not just sa body, dito din. And so very important na malakas kayo for them, na hawakan niyo sila no matter what, even if nahihirapan na rin kayo as a family. Be there for them, because you are the most important support system sa buhay nila.
But yeah, we still have a lot of talk in here, but that was really beautiful. Thanks for sharing.
Thank
Doc,
you.
ikaw naman, ano yung advice na ma-share mo sa mga viewers natin on how to prevent kidney disease and how to maintain optimum kidney health?
Okay, one is if you are hypertensive, diabetic, or overweight, just control your blood pressure, keep your blood sugars at a normal level, and you need to have a good weight. And the second is, I think you have to consider this thing also. Be a kidney donor. Yes, be a kidney donor. It will save
Yes.
life. It will save life. To you, it may just be another kidney or just one kidney, but to others, it is life. That's all I can say.
Wow, thank you so much, Doc. Thanks for the reminder on that. We can really, really save a lot of people. Thank you so much, Doc Polito and Bea. Many of the information that they shared are obviously life changing for many of us. And I'm sure that all of you, our attendees, really had a great time listening to both of our resource speakers. But now it's time for your questions to be heard. We have here a list of the questions that we're going to be going through with Doc Polito and also with Bea. Now, Doc, can frequent urinary tract infection lead to kidney failure?
Yes, that's why if you have recurrent or relapsing urinary tract infection, you need to be seen by a doctor because these infection can ascend to your
Mhm.
kidneys, and that is very toxic to your kidneys. Or else, you need to have that kidneys removed if the kidneys will go up and not treated. So have yourself seen if you have recurrent urinary tract infection.
This is in relation to what Bea also mentioned earlier, and it's good that this was asked by one of our attendees. Is taking too many medications or supplements or vitamins, can that lead to kidney disease,
Oh, is
Doc?
that for me?
I
Okay, sorry.
Is that for Miss Bea, ma'am?
It's for you, Doc, but
It's
we'll
for that.
ask
Oh,
Bea about that in a while. But for you, Doc, do you think taking medications or supplements or vitamins, can that lead to kidney disease?
one thing that we have to consider about food supplements is that food supplement, for the word itself, supplement, it is something that is lacking in your table. So if you think that these elements are lacking in your table, then that's the time that you need food supplements. But if your food that you eat in your table is enough, then there's no need for you to take food supplements. And even if you say that these food supplements are organic, try to think of how these food supplements were processed. What are the ingredients that were included? What are the what do you call that? The additives,
Mm-hmm.
the preservatives that were added, and we don't know. And those things that were not included in the the packaging are the ones that are very toxic to your kidneys and even to your liver.
Bea, do you, like you said, no, you took a lot of supplements, some of those because you wanted to maintain a particular particular, I guess, lifestyle that you had. And you did mention some of those, no, that you were taking that you should have avoided. Pero,
Mhm.
question ko lang, Bea, you mentioned that you drank a lot of coffee.
Mhm.
Tama ba? You
Yes.
drink a lot of
Yes, I
coffee.
drank a lot of coffee, the biggest size in any place you find. Since I was college, so I depended on coffee to wake me up. And I always drink the strongest. I love coffee. I like the smell of it. I like different kinds of coffee. I actually travel abroad just to taste different kinds of coffee in different countries. So since I was a young age, dapat I should have cut it to 175 ml or like a small, every day. So to everybody going through coffee, please just one cup a day is okay. Especially depends on your weight as well. And aside from that, yes, for the my gym life, yes, I only had like the pre-workout because that is at the end now before I got
Mm-mm.
really sick. But before that, I was sent to the hospital so many times by dengue or by food
Oh,
poisoning. So those little things that's normal for healthy people, that is something that actually could destroy my kidney. And I think, doc, right, anybody can also have kidney failure from just dengue or food poisoning as well. So we have to be very, very careful of what we really ingest in our system, whether it be from working out or for simple things going to restaurants. So you really have to be careful where you eat and what you ingest yourself, because you can have organ failure by a small little problem like that.
doc. And that's especially true for someone who's living with kidney disease.
Hmm.
Okay, if Doc, Miss Bea mentioned about dengue. If the dengue is severe enough, like you're losing a lot of fluids, you're losing a lot of blood, that is very toxic to your kidneys. That decreases the blood flow to your kidneys, and that will lead to acute
Presente,
kidney
stop
injury.
moving.
And if you already have a chronic kidney disease on top of any infections, then that will hasten the progression of kidney disease as well.
All right. I needed to go back to the coffee question. Does coffee without sugar, with creamer, affect the kidney big time? How many is considered normal per day? I don't know. Maybe Bea is so tall that she has to drink that much coffee. But how many is considered normal or maybe even safe before it imposes risk to our kidneys? I think that's an important question because for many people, coffee is life.
Yeah,
Yes.
indeed, coffee is life. I had one talk maybe a month ago regarding coffee intake. The problem with coffee is not the coffee itself, but the additives. You know, the creamer, the sugar. These are the toxins to your kidneys. But the brewed coffee, they are good. Even dialysis patient can have brewed coffee, but you have to cut off or stay away from creamers and sugars. So it is the additive.
All right. We still have a couple of questions here. Can suppressing urine cause kidney disease?
Yes. Um, Especially for those who are working at BPO, uh, traffic policemen, wherein they have, little, what do you call that? They don't have access right away to where they pee. So what happens is that you you inhibit the urination, and urine is not that clean. So it will stay longer in your bladder, so that will lead to urinary tract infection. So if you feel like peeing, you have to go to pee.
All right. Thanks so much for that. I think that might want people to go soon. But last on that topic, does the color of the urine indicate how healthy a person's kidneys are?
Yes, if your kidneys is very clear like water, then likely your kidneys are healthy. But if your kidneys are, I mean, if your urine turned red, then you have to consider other problems such as you might have stone that passed. And if your urine is very yellow, then you must be very dehydrated. That's why that is a warning that you should drink a lot of water. So color in your urine is very important.
All right, we are now down to asking our two wonderful resource speakers here who has given us, just great information and has answered so many of our great questions. Maybe we can start with Bea. Can you please give us a list of your keys to living the best life?
So I always say it and over. So if you want light to come into your life, stand where it is shining. So please stay positive. Very important. Eat healthy. Having a very healthy lifestyle. Sleep on time. Have enough sleep, less stress, and most importantly, have a lot of greens. It's very important. The more organic, the cleaner the greens are, the better for your body, the longer you live. And of course, live happily. It's very important. I-focus nyo yung mental health nyo is very important because a happy life is a long life. So who doesn't want to live long life, in order for you to see your family members, to be a parent, to be a grandma. It's very important to live all those. For me, those are my three important keys to living a healthy and beautiful life, and that's what I'm doing right now.
A happy life leads to a long life. I agree. And make sure you keep your
Yes,
kidneys happy too, ladies and gentlemen. Thanks, Bea. It's
thank
really
you.
been such an honor because we get to hear your story from you. So we really appreciate it. And Doc, you've given us really a blow by blow account on how to deal with it through Bea's stories and clarifying a lot. I love their conversation. But maybe you can end it with sharing also keys to living the best life from your perspective.
Okay, one is you need to have a regular checkup, especially if you have Maxicare insurance. You can have unlimited checkup at Maxicare Primary Care Center. So there's no problem with that. Have yourself regularly checked. You will not know that you have problem unless you see a doctor. And then second, monitor your blood pressure as well as your sugars because these are the two most or leading causes of kidney disease worldwide. And then lastly, be cautious about over-the-counter medicines and herbal supplements because um, if you really want to eat organic food, then why not eat the food? Why do you have to eat? Why do you have to drink organic food in a pill form? So that's all.
Thanks so much, Doc. Really, a lot of great and practical things that we've learned from you. Thanks so much to Doc Polito and Miss Bea. We appreciate your time and thank you for celebrating Kidney Awareness Month with us. Thank you for educating us and sharing your knowledge and experience. Take care. Now, ladies and gentlemen, we have had such a rich conversation with our two speakers for today, and we thank all of you for being actively participative in our conversations. I'm sure you all learned a lot, but can we have you guys answer just a short survey that will give us valuable insights for future events? Now, here's a QR code that we're flashing on your screen, and there will be a link also that will be shared on the chat. So you guys will be able to access that short survey that we're talking about. Now, before we announce the winners, remember we talked about that for our raffle? Let's first answer some poll questions real quick. Actually, there's just one for this particular segment. What topic would you like for us to take on and discuss next in our Wellness Friday event? Dengue, monkeypox, diabetes, or proper nutrition? Let us know what you guys think. I love it that Maxicare constantly listens to us and what we want to talk about. What is the result here of what people want to hear? Let us see. It's diabetes. Yes, obviously, me too. It's something that my family has, so it's something that I want to talk about. And of course, something that we all don't know much about, monkeypox, is also on top of your list. Thanks so much for letting us know. Now let's have the names of our winners for our raffle draw, which is exclusive for our pre-registered attendees on Zoom. Let's take a look at our winners. Congratulations to the following: Amor Masongsong, Carol Calyangan, Rafael Cosuco, Janine Valencia, Carlos Dizon, Melody Vicente, Nonato Perez, Rosel Cruz, Abigail, Carol Aldovino, and Graciela Santana. Congratulations to all of you, and we appreciate you being here. Now, for those who would like to also have a chance, like our winners, to win these really awesome prizes, please make sure you register for Maxicare Wellness Fridays event and join us here on Zoom. More details will be shared about that later on. But as we reach the end of our event, we'd also like to take a few moments from you to answer some of these questions also now related to our Wellness Fridays. And again, by a poll, all you have to do is click on some answers, the answers that best suit you. Here's the first one. On a scale of 1 to 5, 5 being of highest importance, how important is it for you to live your best life by focusing more on your health? Do you know that those are related? Remember what Bea said? A healthy life is a happy life. Super connect talaga for us to live our best life. And that's a resounding 5 on the scale, right, for most people. Now let's go to the second one. If you were able to join us in our previous events, have you found Wellness Friday sessions like this one informative and useful regarding how you can take better care of your health? Yes or no? But you having spent this much time with us, 100% yes from everyone. Thank you so much. It really means that it's so important for you and you really, really learned a lot. Now, the next one, on a scale of 1 to 5, 5 being the highest, rate how today's Wellness Fridays event has helped you further improve your health and wellness, and how it will help you make adjustments so that you can really focus more on your health and your wellness. I hope you learned a lot from Bea. I love the sharing. And of course, um, all of us, right? Majority of us will now have this these wonderful takeaway from Bea, and we will now apply that in our lives. Great job, everyone. Of course, I know you enjoyed this experience, but can you share it on your social media? What you've learned here, please use the hashtags Live Your Best Life and Maxicare Wellness Fridays. And please tag Maxicare on Facebook at Maxicare Healthcare Corp, on IG at Maxicare Healthcare, and their wellness IG, Maxicare Health and Wellness. Of course, when you share about your wonderful takeaways, make sure you also tag them because they'd love to know how you're able to process and share what you've learned here. You can also learn more when you watch content on their YouTube channel. So please subscribe and follow Maxicare Healthcare Corporation also on YouTube. To learn more about Maxicare's products, please visit www.shop.maxicare.com.ph, or you can send a message through their FB Messenger as well. If you have questions about Maxicare's Wellness Fridays, you may send an email to maxicarewebinar@maxicare.com.ph. I hope to see you guys on our next Maxicare Wellness Fridays event in May, and the details will be announced very soon. So please make sure that you stay tuned. That's why we asked you to follow their social media accounts as well, so that you guys will know what they have in store. And make sure you register early and be here with us as one of the pre-registered attendees. For those who are watching us on live stream, again, we'd like to invite you to join us on Zoom next time. So make sure you register, and don't forget, we have exclusive perks for those who pre-register for our Wellness Fridays events. That ends our event for today. Thanks so much for being with us. We hope that you enjoyed it and you were able to take away meaningful information on how you can all live your best life. Take care with Maxicare. That's exactly what we can do. Live our best life.